Yeah, but don't put this in the script. It's my script. It's my script. Hello and welcome to CancerFace. This is going to be a weekly blog, or vlog as they call them these days, which is going to be looking at my experience of having cancer. The reason why I'm doing this is really because I'm very struck by how, when one receives a diagnosis of cancer, it becomes pretty much an all-consuming part of your identity, as it were. I remember once, a while back, 3 or 4 years ago, worrying that I might have bowel cancer because I had some PA bleeding. I go to the GP, and on my way there, I remember thinking, gosh, you know, if I do have cancer, I'll become a kind of a cancer patient. And that'll be pretty much a full-time job, or not job, a kind of role I'll be ascribed in life, an identity. And that's true, I think, both inside. You know, you find it very difficult to shake the thought that you've got cancer from your mind. But also from the outside, I remember, but quite recently, over the last year or so, a good friend of ours, a partner, was being diagnosed with cancer. And I can't think of his name without immediately associating with cancer. If I did a word association and someone said, Trevor, I would immediately think cancer. So that's why I'm doing it. And I think rather than kind of put up some kind of futile resistance to this sociological fact, what I thought I'd do is embrace it. And so this vlog's going to be about what it's like to have a diagnosis of cancer and to live with it. Now mainly it's going to be just me sat here talking. I'm going to do short weekly episodes, no longer than 15 minutes. But do feel free to ask questions if you'd like. So, of course you can't, so yeah, sorry, forgot. But it's mostly going to be just me talking. Nubbins will be here as well, and he may interject if he thinks there's a particularly pertinent point that he wishes to make. But that will probably be quite rare. Nubbins' moments of pertinence are usually pretty rare. But I was a bit worried it might be a bit dull just sat listening to me talking all the time. So we'll try and vary it. As I keep the episodes reasonably short. You may find that week by week that there are certain visual changes. I might get various paraphernalia around my kind of throat and neck area. I might get one of those voice boxes that makes you talk like a Dalek. So hopefully that will add a little bit to the entertainment value. So what my actual cancer status is at the current time is that I was diagnosed with bladder cancer. I was actually diagnosed early in February. I noticed some blood in my urine last November. Rather foolishly, didn't get past. It was just the one once or twice early November, and rather foolishly, I didn't go to the GP until also in January. And when I did go, she sent me off to what do they call it, cystoscopy at Morton, which showed that I had this large tumour in my bladder. And I'm currently receiving treatment for that. But in addition to that, I also developed this kind of sore throat. Actually developed it about 10 months ago. And after numerous visits to the GP, which we'll come back to, after a few visits to the GP, then what happened was that these lymph nodes in my neck started to swell up and get really quite hard. And on what must have been the third or fourth visit to the GP, but we also, of course, we were concerned about the bladder cancer, but they said, oh, we better get that looked at too. So I was referred actually to a different hospital. Bladder cancer bit has been done in Scarborough, but I was referred for this to the ear, nose and throat department at James Cook Hospital in Middlesbrough. And we went there and they took some samples from my lymph nodes and called me back last Monday. And they said that is also a cancer, but they don't know quite where. And they're trying to find that out at the moment. They do insist that these cancers are totally unconnected. And we'll come back to that because I find that a little bit difficult to believe. But the bladder man, I showed him my lymph glands, and I spoke with him, and he said, well, I'm not sure what it is. Thought it might be glandular fever or something. But I can assure you that it's nothing to do with your bladder cancer. And the ENT consultant equally is convinced that whatever cancer I've got in the probably throat department isn't linked, to the bladder. I suspect they're wrong, and we might find that out fairly soon, possibly for the next episode or for the one after that. So at the moment, this is being investigated. I've just been for an MRI scan yesterday, and I'll be going for a PET scan on Monday. What's that? All right, yeah, very good, very good. Nubbsy says they'll probably find a hamster, a guinea pig, and a goldfish on the PET scan. Thank you, Nubbsy. But that will show, the PET scan will show, that's a whole body PET scan. The MRI scan, which is to the neck, but it's a whole body PET scan, and that shows where there is bother inflammation, I think it is, anywhere in the body. So my guess is that although people say, oh, your bladder and your throat are a long way apart, so they can't be coming from the same source, but it wouldn't surprise me at all to find that actually there's something in between, and that is linked to both these other cancers. But hopefully they're right, because it would be good if they were, but we'll see about that. So the official line is, I've had the MRI scan, PET scan to come, then they'll do a biopsy of when they can locate what they call primary source or site, and then we'll have a meeting to discuss the treatment options, which may include surgery or radiotherapy depending on I guess where it is. There's also something about when you get cancer that you find that there's a bit of a guessing game goes on with the consultants, and if you're kind of smart, you can guess what's going on before they really want to tell you. So for example, if I have the MRI scan and the PET scan, and then they call me in for a meeting before we've had the biopsy, well, that actually says to me that I'm right, that I've lit up more areas than the throat and the bladder, and that in fact we're looking at more widespread cancer. And I think, again, my friend whose partner has got cancer said that his PET scan lit up like a Christmas tree. And if it's something like that, we're looking at multiple sites, then that will be kind of revealed by the fact, I think, that hopefully they won't put me through all the biopsy stuff, because if I've got cancer or everything else, or a few other places, then they might decide that, what's the point of chopping off his tongue out or whatever. So that's kind of one example of the guessing game that goes on. I mean, when we went back recently to get the results of the lymph node tests, again, a couple of clues there. The secretary was very anxious before they got the results back. I phoned her to make the appointment, and she was saying, "Oh, I can't tell you the results myself," which is fair enough. But a couple of clues were, one is she gave me a 1:15 appointment on the Monday, and I think this was the Thursday I found her. So, why are they seeing me so quick? And a 1:15 appointment when I'm pretty sure the lunch break finishes at 1:30 means I've been squeezed in. So pretty clear that might well be going to be bad news. And then when we go into the meeting, lo and behold, there's a Macmillan nurse sat there. And although I didn't pick up on this actually, but my partner Sally did, and she thought immediately, she saw the Macmillan nurse, this is cancer news, otherwise what's Macmillan nurse doing here? So there's all this sort of marvellous game being played as well, whereby one tries to guess what's what and subvert their attempts to communicate things to you in a certain order. So that's where we're at. There's bits I might well come back to, particularly I think I need to talk a little bit about the GP process, and because it was actually last August that I first went to the GP with a sore throat, which had been there for about 4 weeks, and I said, I'm worried there might be something sinister going on here. And they took a blood test which came back normal, and that was that. And then lo and behold, 10 months later, I've got some kind of cancer of the throat region. So there's something to be learned, I think, about going to the GP, which will come in time. But we'll talk about that in a future episode of this vlog thing, what we're doing. But for now, it's bye-bye from me, and it's bye-bye from Nubbsy. Say bye-bye, Nubbsy. And this next week, as I say, there should be some developments. And we might well know the answer to this. Am I going to have these biopsies, or is it straight into the palliative care mode if I light the thing up like a Christmas tree on Monday? See you next week. Excuse me, lad.